My name is Meghna Iyer, and I'm a candidate for a Bachelor of Science in Health Science at Northeastern University. I'd like to discuss my research project through the CaNCURE program on silica-based bismuth gadolinium nanoparticles in radiation dose enhancement in lung cancer. Although radiation therapy is an effective treatment for lung tumors, the inherent motion within lungs creates a continuous struggle between minimizing healthy tissue dose while maximizing tumor dose. In this project, I investigated the use of a novel radiation therapy using 3 formulations of silica-based bismuth gadolinium nanoparticles. Nanoparticles with a high Z or atomic number, like gadolinium and bismuth, can augment the effectiveness of radiation and increase the localization of radiation doses at the site of the tumor. Nanoparticles act as radiosensitizers through the photoelectric effect to cause radiation enhancement when a photon interacts with high Z particles and leads to a greater production of secondary electrons, which generate DNA double-stranded breaks. These double-stranded breaks lead to DNA damage and incurs an additional immune response to target cancer cells. This project determined if the addition of higher Z bismuth nanoparticles is associated with increased DNA damage to potentially enhance radiation therapy by studying DNA damage assays after irradiation. In order to conduct this research, I began by performing cell culturing and propagation of the A549 non-small cell lung cancer cell line. I then treated the cells with both nanoparticles and radiation and conducted gamma H2AX DNA damage assays to determine the amount of damage occurring with each formulation of nanoparticle and radiation dosage. Finally, I used a confocal fluorescent microscope to quantify the DNA double-stranded breaks occurring to each cell through the gamma H2AX assay, and a macro I built on the software ImageJ to automatically count and analyze the foci present in each image taken on the microscope. The gamma H2AX DNA damage studies show the radiation response of cells at 4 gray and 6 gray demonstrated significantly increased cellular damage in combination with nanoparticle treatment. In 6 gray, there are 74 damaged foci in double-stranded breaks on average and the highest bismuth ratio nanoparticles, AgEx-BI 3070, and 61, 55, and 45 foci respectively, for lower bismuth ratio nanoparticles of AgEx-BI 5050, 7030, and the control, which shows that higher bismuth ratios cause more DNA damage. Representative images are shown on the right to exemplify this difference. The high levels of DNA damage presented by double-stranded breaks demonstrate that the optimum bismuth gadolinium ratio of nanoparticles is AgEx-BI 3070, the highest ratio of bismuth in the 3 formulations of nanoparticles. This shows that the addition of higher Z nanoparticles is associated with increased DNA damage and that silica-based bismuth gadolinium can enhance radiation as a lung cancer treatment. The preclinical implications of this project allow for the identification of the ratio to be used for further evaluation in vivo. This research can continue in the future through assessing survivability and toxicity in vitro of the 3 formulations of nanoparticles to further confirm the optimum particle. The nanoparticles are also being used in animal models to provide extensive preclinical theranostic data to show nanoparticle tracking and radiation dose localization while acting as a contrast agent in MR. The first generation of AgEx are now approved for use in the clinic as well. I would like to thank Professor Shrieler and Professor Vandeven for creating the CaNCURE program and for providing us with countless opportunities to learn and grow as researchers. I would also like to thank my faculty mentor, Dr. Berbecco, my day-to-day mentor, Dr. Nita Varani, and Dr. Romy Mueller for all of their continued patience in teaching me and supporting me throughout my research experience. Thank you.